Any hope for my eyes? I had eyelid surgery done twice. Hi. I can't go into details, but basically I had bleph plus ptosis repair done twice. First surgery led to multiple complications. Then the second surgery, one eye is smaller than the other, and the fold feels very heavy, like it's full of lead, whereas the other is light and feels natural. I kind of feel hopeless because my right eye just feels so heavy, and I don't know why or how a doctor can fix that heaviness. I was thinking maybe scar tissue is weighing it down. Thanks in advance.
Thank you for your question. In your question, you describe having had to have two surgeries related to eyelid ptosis, and that at this point, although it's unclear exactly how long it is since your last procedure, you're concerned about a heavy feeling in the eyelid and what to do about it. Well, as a cosmetic oculofacial plastic surgeon, I can tell you, in practicing for 20 years, that ptosis surgery is one of those procedures which it can go beautifully well and you can do a great job and everything looks fantastic. And then in other cases, you can actually have to do not just one, but more than one revision surgery. So, that being said, when we think about surgery to this relatively limited space, it can be understood that the sense of heaviness is often the result of swelling, that being internal swelling or tissue swelling, and it can also cause the eyelid to drop a little bit, particularly if there is enough swelling that it actually causes a physical weight on the eyelid. Sometimes we refer to this in a way like mechanical ptosis, where in cases of more obvious mechanical ptosis, it can be an actual lesion or something that is physically weighing down on the eyelid. Swelling can cause drooping of the eyelid. In addition, the healing process of the muscle, the levator muscle, can also take a little bit of time so that the eyelid may come up a millimeter or so or half a millimeter and get you closer to the symmetry. I could just tell you a little bit of how we do our procedures in terms of ptosis surgery. When we do ptosis surgery in our practice, to ensure the likelihood of success, in other words, getting the appropriate height, contour, shape, symmetry, during the surgery we actually sit our patient up and we will look. Now, of course, the patient doesn't feel any pain, they're numb, but they're alert enough that we can look at their eyelids and make adjustments, sometimes even while they're sitting up, to get that as close to possible the final result. We statistically, close to 100% of the time, or probably more like 95 to 98% of the time, we're able to predict that if it looks good during that procedure, that it will look good afterwards. And of course, over a 20-year career, there are exceptions to that rule, and you just have to kind of deal with that when it happens. So from your perspective, I think that communicating with your doctor and discussing this feeling of heaviness, and your doctor examining you and giving you an idea of what to anticipate. Surgery, any surgical procedure, regardless of location, can take up to 1 year for full healing. And I've even seen with scars and other things, there be even further maturation beyond a year. So when you're talking about this area of the delicate tissue of the eyelid, which this tissue is less than half a millimeter in thickness, you can understand that a little swelling can cause a lot of impact. So you have probably some time to allow for adjustment. When you have also ptosis surgery, it's usually due to some type of issue related to the anatomy of the muscle, the levator muscle. The word levator is like the word elevator. That muscle may not move in the same way as the other eye, and that takes some getting used to an adaptation. So there are factors here that probably contribute to that heavy feeling that you're so concerned about. So again, my recommendation is you meet with the doctor who did your surgery, discuss this feeling, give the doctor an opportunity to examine you and see what can account for this feeling, and I suspect that with time things will get better. So I hope that was helpful. I wish you the best of luck. Thank you for your question.